Hello, this is Lisa Lanasa with the website Diaverge.com, and I want to demonstrate to you today the difference between what I use to treat a low blood glucose level and what the common recommendations are between the ADA and other organizations. First of all, we have two pre-measured cups of sugar here, and I have three identical empty cups. So we are going to put one of these on our scale and get it to 0 and make sure that all of the different cups measure the exact same weight, 0. And the third one, oh, there it goes, and 0. Perfect. What I use, because glucose tablets are not available in my market, is I would use a packet of sugar. And yes, you can say that I'm a sugar thief, but these are the absolute best for me. So what I would do is get this to 0 and weigh it. This weighs 6 grams. I need exactly half of one of those packets to treat a low blood glucose level. And what I have done here is I have already pre-measured. Oops, I have to get this back to the appropriate weight for a container. We don't want to take into consideration the weight of the container, so that is 3 grams of sugar right here. Now, Dr. Bernstein actually recommends using glucose tablets and nothing but glucose tablets, but in my market, glucose tablets are not available. So what I use is granulated table sugar to treat a low. And here is what the ADA recommends at a minimum of 15 grams of fast-acting carbohydrates or a tablespoon of sugar. This is 15 grams, and now I also wanted to measure out for you what is 1 tablespoon. That is approximately 1 tablespoon. It's slightly rounded, but a little bit lower on one side. So I'm going to put my cup back on the scale, and I'm going to put the tablespoon of sugar into it and see what we come out with. Oh, that's 14, which is very, very close. And so this is a very different amount between my 3 grams of sugar right here and the recommended 15 grams, at a minimum 20 grams usually, to treat a low blood glucose level, which in my case would send me up to 200 milligrams a deciliter blood glucose or blood sugar level at the very minimum, if not more than that. And then I'd be injecting more insulin and possibly going low again as a result. So in my case, it's much better when following a low-carb diet. Follow the recommendations of Dr. Bernstein. Use a small amount of small amount of carbohydrates, small amount of insulin, and a small amount of sugar or glucose tablets to treat a low blood sugar level, so you're not shooting way past the target market of 83 milligrams a deciliter blood glucose. Once again, ADA recommendation of a minimum of 15 grams. What I use, 3 grams. And that's it. Thank you so much for watching, and thank you for following Diaverge.com.